Yeah, of course. Please go ahead.
At least for my own purposes, I would like to record these.
Yep.
If I feel like it'll be helpful to other people, maybe I'll post it. But if not, I'll just keep it for myself.
Sure.
But I have made you the co-host, which means, do you have something you want to share?
Yeah, it's just like a quick slide presentation. I think it just goes along with like my talking points.
Okay. Well, let's turn the floor over to Shreyas, and he's going to talk to us about why we should have universal healthcare. Google Slides. I've become familiar with Google Slides because of my children. They use them a lot. I feel like all kids that are in high school and middle school now are going to use Google because it's free, and Microsoft is going to get used less and less because it's not free.
That's fair.
All right, sorry, go ahead.
Let me turn on my video. Okay, cool. Are we ready to go?
Yes.
Okay,
Call
cool.
you.
So good morning, everyone. We're here to talk about whether the U.S. government should provide universal public health insurance coverage to all its citizens. And I'm strongly for this issue, as the United States has both a responsibility and a commitment to both their citizens and economy. So I don't mean to start this argument off with a sentimental moral argument, but I would firmly like to establish that each and every citizen of the United States should have access to decent healthcare as a basic human right. For far too long, Americans have suffered from large medical expenses due to the failure of private insurance companies only covering part of medical expenses, or the government failing to provide every citizen with same quality healthcare. It only provides to some. So this leads to many uninsured individuals to even file for medical bankruptcies that leave individuals unable to pay their own bills and suffer lifetime illnesses due to their inability to pay. So this is happening within a country that's supposedly supposed to have the best healthcare. And so this brings me to my first contention. So my contention number one is that the United States is an extremely wealthy country that spends more on healthcare, nearly 16.9% of GDP, which is twice as much as the average OECD country, and still has the lowest life expectancy and highest suicide rate among those 11 other wealthy nations. So before getting into this, let me ask a question for those who believe universal healthcare is detrimental. How does one of the wealthiest countries who provides private healthcare insurance and provides Medicare/Medicaid to those who are eligible still perform so poorly in terms of providing healthcare to its citizens? So the United States spends nearly $3.6 trillion on healthcare yearly, and analysts have concluded that the United States wastes an approximate $760 to $935 billion annually in aspects such as overtreatment tests and other forms of healthcare, such as like overtesting. So this accounts for almost a quarter of the budget that could be put towards funding a universal public healthcare system. And the main misconception with this is that many individuals are scared of costs of implementing a universal healthcare system, mainly due to high taxes. However, that's a myth. It's not true, because looking at the immediate problem at hand, looking to stay at a hospital for about an average of 3 days would cost the average individual about $5,000 to $30,000, or even more depending on the extent of the injury. So with the current private health insurance that covers nearly 67.4 of the population, and public health insurance that covers 34.1% of the population, neither one of these insurance cover the full cost of medical bills. So that's the biggest scam with private insurances, is that many individuals pay premiums and deductibles every single month, but still when they have to go to the hospital or incur some kind of medical bills, they only pay some of it until their full deductible is paid. And insurance companies claim that they are not responsible for a part of the cost. And like I said in the beginning, this contributes to many individuals filing for medical bankruptcies or leaving them in fear to even go visit a physician to get attended to. So that's the main issue with healthcare today. Insurance claims to cover costs of medical expenses, but people neglect that they have to pay premiums every month to stay on a plan and have to pay even part of the medical bill when they get treatment at a hospital. So these costs add up massively throughout the United States and discourages individuals from visiting PCPs or even going to hospitals to get treated, leading to numerous problems within the U.S., such as the lowest life expectancy or suicide rate. So this circles back to my first argument that the United States spends twice as much as the average OECD country and is still subpar in numerous health categories. And thus, with a failing healthcare system that seems to be doing fine, it is better to switch to a universal public healthcare system. And so this brings me to my second contention, which has been introduced through bills and has also been publicly supported by the citizens of the United States, is that many believe that switching to a universal public health insurance is highly detrimental to the cost of the economy. But studies show that a single payer healthcare finance system is highly beneficial to both citizens and the long-term plan of the US economy. So according to many published articles in NCBI and PMD, there's a widely accepted study that has implemented 22 different models, 8 national and 14 statewide public insured models that have shown significant results, better than the private and public health insurance that we have today. So the reason why our healthcare system is so perfectly broken is because the higher costs of healthcare in the current U.S. economy are due to higher prices of administrative inefficiency and not the higher utilization of facilities. So with various healthcare initiatives for universal healthcare in the U.S., it's estimated that in the first year alone, there are high chances of saving approximately $313 million in the first year of implementation. So coupled with the other costs, these costs of saving and the U.S. wasting the funds that they allocate to $3.6 trillion are just building up and are wasted, which could be shifted to funding universal public insurance. So like I said, from doing these experimental analysis and other model experiments, it has shown that these plans, if they were to be implemented in the long term, there would be simplified payments for administration and insurance and providers, drug reduction costs, and higher utilization of facilities when these inefficiencies are handled, leading to a more accessible system for citizens. So it can also be argued that a potential universal healthcare system could be a Pareto improvement to the economy, as it makes it more efficient and no one is worse off when everyone is receiving healthcare to the highest standard. And when I said that there were bills introduced, there are 2 bills that are currently on floor right now that are being debated for. But as you all know, Bernie Sanders also introduced a plan when he was running, and his plan was called Medicaid for All, which would provide universal coverage for Americans. So his plan was that over the next 10 years, it would cost about $25 to $32 trillion, which would be funded by the current government spending, and other plans such as increased taxes on those who earn over $250,000. And looking at this from a different perspective, using a stat that I previously mentioned, the U.S. spends an annual $3.6 trillion on healthcare, and is still and its citizens are still not receiving its best healthcare and are shying away from these facilities. But multiply this times 10 over the next 10 years, if this value remained constant, it would still be $36 trillion. Even more than the plan proposed for universal healthcare, which would benefit all citizens and provide accessible healthcare. And going back to one of the misconceptions, everyone shies away from these high taxes statement just because raising taxes to fund this healthcare program is something that they don't look forward to. However, they keep paying premiums and deductibles every single month, and then when they actually have to incur a medical bill, it might be even more than they have to pay for these high taxes and can't afford it. So it would be better to move towards a universal healthcare system for the citizens in the United States overall. Thank you. Oh, I just realized I did not go through with the rest of my graph, but sorry.
You want to tell us what that graph is?
Yeah, so I can just quickly go through this graph. So for my contention number 1, this one is just trying to show that this upper line right here is the United States spending way more than any other OECD country, and these OECD countries are still considered very wealthy, but still provide a significant amount of healthcare to its citizens, and it's actually reaching them. Whereas the U.S. is spending as much, but citizens still shy away from the facilities due to their costs. And this is just a supporting point for the low life expectancy and the higher suicide rates in the U.S. But coming to this one, this graph is the most important because this shows the 22 supposed plans that have been tested in model experiments. And it shows the Medicare payment rises, the reduction in efficiency and fraud, and the simplified payment in administration and drug reduction costs overall. So as you can see, each plan has a varied amount of cost to the system. And, you know, as you can see right here, they implemented a system in 1991 called the Grunbach, which has a lower amount of total health by system costs. And over the years, they've done this from 1991 all the way up to 2018 and are now debating whether which one would be most efficient and which one would be in the best interest of the economy.
So actually in this graph, the red is the cost and what's right next to the red is the benefit. And you can see sometimes the red is higher and sometimes the red is lower. So I guess that's why you might say the results are mixed. Sometimes it seems like the universal healthcare saves overall money, and sometimes it seems like it doesn't. It costs more.
Yep, and that was. Sorry, no, go ahead.
You can go ahead.
No, I was saying, and that's the beauty of this graph because it shows that there have been extensive studies conducted to sort of broaden or to narrow down the risk of these plans, and it shows that through the extensive study of this, there are certain plans that actually work and have higher benefits or have a higher net savings and a higher net cost.
Yeah.
Also, just a point, all this information that I got from these graphs and my own points, it's included in the bibliography at the end.
Okay. All right.
Yep.
You got
stop sharing.
Yep,
I am.
Thank you for the presentation. Thank you. Does anybody? I don't know if you were planning to have some kind of rebuttal. Were you?
I had like talking points for, or like just like points.
Like for example, if there was another side who was talking about the reasons not to have universal health care, did you have something you wanted to say to rebut that, or?
I mean, if it does come up, I do have points for rebuttal, but
okay. Well, why don't you save those until we have a little bit of a discussion now. Okay. I'm the moderator of this debate. I may have to give some of the talks. Does anybody have any questions or comments about this topic? Something that maybe you wrote about in your homework and hasn't been brought up yet? Maybe no one does. Well, let's have a discussion about some of the reasons not to have universal health care, and then this may help Shreyas by giving him something to rebut if we just bring up some of this stuff. I would say the first thing to talk about is rationing and long lines. What do you guys think about this? If we switch to a system where there's zero out-of-pocket healthcare payments that you have to make. If you feel like you may have a cold, you can just go to the doctor. If you feel like, okay, so I guess this is the first idea, is that's impossible. It's impossible that anybody who wants to can see any doctor at any time, because doctors just don't have that much time in their hands. Like, let's say you wanted an MRI for some reason. If literally just anybody could walk in and get an MRI, that would sort of lead to at least an inefficient use of the MRI machines. So maybe we have to think about who would do the rationing in this model. Who decides which people get to use the healthcare services in something like universal healthcare? Do you guys have any thoughts about that? What would we go to? Would you need to see like a special, see your primary care physician first, then get a referral to go to a specialist, and then another referral if you need to have even sort of further? That's kind of the model we have now. What do you guys think? Let's just talk about the rationing. Would you think rationing would be a problem if we had universal healthcare? Yes or no? Please, please give me any opinions that you may have on this topic.
I think it might be a small issue at first. Like, when the system's first introduced, yes, there would be longer lines because you have so many people that just choose not to go to the doctor for things that they simply can't afford. So I think at the early stages of implementation, yeah, you're going to see an influx of a large amount of the population seeking care that they've needed for a long time. But after that period, I think that once there's sort of like a nominal equilibrium of people that have finally gotten the treatment they needed, no, I don't think that'll be a long-term issue.
So you're saying rationing is not an issue, and therefore people sort of ration on their own. Is that what you're saying? Like, they decide on their own, do they really need to go to see this doctor? And in equilibrium, they make this decision of the right amount of time. Is that what you're saying?
Yeah.
Yeah. Because critics actually don't agree with you. A lot of people think that there's this moral hazard problem. It's like moral hazard. Basically just means, in this case, it means if you get free stuff, you're going to take it. And, for some things like surgeries, people don't want surgeries. So I don't think people are going to say, hey, give me surgery. I want more surgery than I need. But there are some things that are in between, like let's say physical therapy. This is something that people could benefit from, but as of now, there's a cost to it. There's this procedure you have to go through. You have to be referred. Generally, you don't just show up at a physical therapist and say, hey, could you do some exercises on my back? I've been having some lower back pain. I'd like you to help it out. The idea is there's people who are kind of on the margin. They're trying to decide whether or not to do it. And if you tell those people you can have this service for free, then everyone on the margin is going to say they want it. Rather than having some sort of pricing mechanism do the rationing, which is what the argument, if I'm right now, I'm arguing in favor of leaving it private medical that you have to pay for, and then you have to pay the copay and everything like that, and you have to get a referral too. You have to first go to your primary care physician, then get a referral, is that there has to be some kind of rationing for these marginal consumers to decide which of them are going to say, yes, it is worth it for me to get the thing, and which one is not worth it. I have a totally different example, and that's parking. Before I was at VCU, I was at Florida State, and the parking was terrible there because they had no rationing. Parking was free for everybody, or for every student. Every student had free parking. The faculty had to pay for parking, but it was totally, it didn't just say at all where you could park. It was basically say you could park anywhere on the whole campus, but no, it wasn't. In other words, they removed the pricing mechanism as a form of rationing, and it made everything worse. If they had just put some fee, even if it was a small fee on parking, and then only the people who really wanted the parking would get it, people who didn't wouldn't, it would make the number of people trying to park reasonable. Instead, there were never any spaces, and you had to drive around for a half hour looking for a spot. It was ridiculous. Okay, this is me as an economist saying sometimes prices are good. Sometimes prices actually serve a purpose, which is to ration whether or not, who knows the best whether or not this thing is worth it for you. It's you, the consumer. And by having a price, it's like a barrier that only the people who value it above the price will get it. People who value it below the price won't. And so let's think about healthcare. If healthcare just becomes totally free, we lose that. We lose that mechanism. And I'm not saying that poor people don't deserve healthcare. That would be a horrible thing for someone to argue. And in fact, this is one comment I had about Shreyas talking about the United States and how bad our healthcare was compared to the other OECD countries. You said something about we're not getting the best healthcare in this country. Even though we're paying the most, we're still getting like the 20th best in healthcare or something like that. I think if you look at those numbers, what you'd see is that that's based on inequality. That's based on the fact that poor, low income people in this country have terrible healthcare outcomes. It's not that people with a lot of money are having bad healthcare outcomes. They can afford it. They can afford really good healthcare and they're getting it. I think this is an income inequality issue manifesting itself as a healthcare issue. Why is our healthcare, why are our healthcare outcomes so bad? It's because we're not doing enough to take care of people who can't afford healthcare. And in fact, you said that in the beginning, and I like that a lot of this is perhaps the inability to pay for healthcare. So if I'm arguing against universal healthcare, I really don't want to say you're on your own, because that's not a good economic argument. Why? Because of externalities. We all benefit when we're healthier. I don't know if you said this, Shriyas, but I think this could be something you argue for us, is that good health causes a positive externality on everyone. For example, this virus, if you get sick with this virus, you are causing a negative externality, at least an expectation, on other people. If we would all wear masks, we would all get a vaccine once it comes out and socially distance ourselves, we would all benefit each other. So, and actually an economy is more productive. And of course, people buy more stuff when they're healthier and they're going out to bars and restaurants and movie theaters, etc. So the economic argument can't be that health is a private matter. Everyone should just be on their own. No good economist would argue that. Maybe the extreme libertarian might argue that, but there's such a case to be made for we're better off when we're healthy. The question is, how do we achieve that goal? And you might say the private market is good because of rationing, of price rationing. If you don't have it, you may have longer lines, which also are a form of inefficiency. Or maybe it's not longer lines, but maybe it's just harder to match up doctors and people. For example, you have a doctor, you want to keep it. It could be that if we switch to a different system, so many people want that doctor that it's unavailable, that he or she is unavailable. So, excuse me. So I guess that argument is, I need another tissue. I'll be right back. Okay, I'm here. You lose a little bit of choice. Economists believe choice is important. The more choice you have, perhaps the better off you'll be, especially because there's private information. You know best what doctor works for you and what plan works for you. And by having a multifaceted, multi-layer system that we have now, you can get an HMO, you can have a PPO. Maybe your job offers you this particular option you want to take. Maybe you say, I don't want that option. I want to go with a different option. Generally, economists believe it's good to give people more options because they can optimize on their own. And if this system, kind of like the Bernie Sanders, Elizabeth Warren plan, essentially eliminates private health insurance, then there could be some loss of utility from the people who really preferred a specific plan that's no longer available. So that would be another argument against it, just removing some of the choice. And do I have a third? Do I have a third one? Moral hazard, but that's not a very good argument. Moral hazard says if you know you're going to be, your bills will be paid, then you'll go ahead and do things that get you sick. Like I might as well smoke cigarettes my whole life, knowing that if I get lung cancer, someone will pay for it. I don't buy that argument. I'll say it, but I don't believe it, because health is something that you care about whether or not you have to pay for your doctor bill. You still care about not getting lung cancer, I would assume. If you smoke, it's not because you think, well, you're not thinking about the dollars you have to pay in case you get sick due to your smoking. You're just doing it because you don't really care about the future and you feel like having a cigarette. Okay, I think that's it. I think that's all of anybody else have any arguments they want to give against universal healthcare? I probably forgot some. Oh, what about the cost? Oh, totally forgot about the cost. This is not cheap. This is a massive, massive expense that the taxpayers will have to pay. Wow, this is the biggest one. This is probably the number one reason people would be against universal health care is who's going to pay for it? The answer, taxpayers. And the question is, if there's this enormous tax burden placed on either individuals or corporations or however you do it, is that going to harm the economy? Is that going to be something that's so costly that we all wish we hadn't done it? And this is a hard problem to ask. At least Trias had that chart that said, here are the costs, here are the benefits. But if you had truly a universal healthcare plan for the entire country, that is a massive, massive cost. It would increase the government expenditure. You would need to increase taxes somehow. And there's an issue of what's the best way, what's the most fair way to increase taxes. Some people are going to say, you can't. If you increase taxes too much, people will change their behavior in a way that means you're not generating as much taxes as you do before. This idea that like if you tax people too high, they'll stop working, or at least they'll stop doing what they were doing before to generate that income. So there's that income. There's that argument too. That's probably the biggest argument. I don't know why I've almost forgot to mention it, but this will be a massive expense that the taxpayers have to pay. And then the question is, do taxpayers think it's worth it? You could poll them. You could say, okay, taxpayers, are you willing to pay more for this universal health care? And I think right now it's polling pretty even, isn't it? Does anybody know what the poll numbers are? It's pretty close to 50-50. I'm not sure. I think if anything, it's been increasing.
It's actually been increasing to 70-30, but then when the cost of this plan is introduced, it starts dropping just a tiny bit.
So what's 70-30? Are you talking about Obamacare, or are you talking about full universal health care?
Full universal health care.
It pulls 70% are for? Wow, I would not have guessed. That's not possible. There's more than 30% of the country are conservatives. How could they support universal health care?
That's from a study I read when I was researching for it.
Well, that seems dubious to me, but what I thought was that it was close to 50% and the trend is up, meaning that, when I used to teach this years ago, I thought pretty soon it's going to be more than 50% of the country supports universal health care. And I haven't gone back and updated what the public opinion was, but I think the reason it's important is if you're going to charge taxpayers, if you're going to collect money from taxpayers, you have an obligation to do it in a way that they would think it's worthwhile, because we have a representative democracy in this country where our representatives go to Congress and pass laws for everybody, whether or not you voted for them. That those are your representatives, and they have a duty to sort of represent the people accurately. And if let's say if it's truly 70% of people that support universal health care, then it's like they have an obligation to pass it. And I'm wondering why it hasn't happened yet. But yeah, I think that's it. Anybody else have an argument against universal health care before you see if Shreyas wants to give a closing rebuttal / closing argument? Anyone? Okay, should you want to say anything else, Shreyas, before we end this thing?
Just like a quick couple sentences. Just that.
Rebut my arguments, if you can.
Yeah, sure. Okay.
Do you want me to summarize them? The first one was bad. The second one was choice is good. And the third one was it was very expensive. It will be very expensive. Did I say any other major ones? I said moral hazard, but then I said forget about that one. That one is so easy to rebut. I rebutted it for you. But if you want to say anything about the other three, I don't know. You don't have to.
No, I mean I can just touch up on it really quickly. So I see what you're saying about that rationing is bad and choice is good. But As you mentioned, this does definitely relate to income inequality and it's contributing to our healthcare issue. And that, the the lower and middle income classes are not having accessibility to healthcare as they should. So this plan should definitely help them, but should not also eliminate the fact that those who do have the necessary funds to pursue a higher quality of healthcare, that should not be eliminated. But that doesn't mean that those in the lower and middle income classes should have no access to healthcare whatsoever. So I'm saying with this proposed plan that there should be some choice still, but there should also be a basic infrastructure within this healthcare system to provide for the lower and middle income classes. So that choice should still be there, and it's not like completely gone, if that makes sense. And in terms of it being expensive, that's you are right. It will be expensive. It's not going to be cheap. And like Bernie Sanders proposed, it was going to be in between 25 and 32 trillion dollars over the next 10 years. That's a huge sum of money, but it doesn't mean that U.S. isn't already spending as much or even more per year on healthcare, and people are still not getting it. So, like I said, multiplying that by 10, so 36 trillion, and it's more than the proposed cost. And in the long term, it benefits everyone as much more than it is right now. So, looking at it from like breaking it down and looking at it from a technical standpoint, it's actually better to pursue a universal public healthcare system than it is to keep what we have going on so far. Yes, so that's what I had to rebut it with.
Yeah. Here's another way you could have said that. Yes, you're going to pay more in taxes, but you're going to pay way less in healthcare premiums. You're paying thousands of dollars in healthcare premiums now, and you won't have to pay any of that.
Mm-hmm.
This is what some of the messaging that Bernie and Elizabeth Warren were trying to get across, and that they were getting hammered on this idea because your taxes are going up, your taxes are going up. But the counter argument has to be, yeah, your taxes are going to go up a little, but your healthcare costs are going to go down by more than your taxes went up. And I think if they made that argument to the American people, that may have been a winning argument. Mm-hmm. Okay. Anybody else have any comments? We didn't talk about today is adverse selection. That's the thing I always want to talk about, right? Adverse selection. Which of these plans, universal health care or private health insurance, which of them has an adverse selection problem? I'm testing you guys now. You all failed the test. Do you understand the question? Oh, somebody wrote in chat. Private. That's right, Colin. So the private insurance has an adverse selection problem, but universal healthcare doesn't? That's what you're saying, right? Yeah. Do you guys see that? Does everyone agree? That's what Colin says if you check the chat. I agree. This is another reason to support universal health care. It's that, or at least something like Obamacare. I should say that too, that the Affordable Care Act, also known as Obamacare, was largely built. It was built by healthcare professionals and people who study this for a living. And it's like 1,000 pages long. It was designed by economists, by health economists, to overcome the best they can this adverse selection problem. In other words, which of the two systems would have the adverse selection problem worse? Of course, it's the private care problem, because if you offer a premium, it's the sickest people the least healthy people are going to want to accept it because they know they need the insurance. The healthy and young and overconfident people are the ones who aren't going to buy this health insurance. And you need in my opinion, you have to have some system that encourages or forces, even with an individual mandate, those young and those healthy people to join the pool of people getting insured, just so that the death spiral of adverse selection doesn't happen. So as an economist, I think you definitely at least need something like the Affordable Care Act to prevent the adverse selection problem from getting out of hand. And it was out of hand beforehand. There were people who were just simply uninsurable. No one would be willing to give them any insurance, and there were 40+ million people who were uninsured. The Affordable Care Act helped to alleviate that problem, the adverse selection problem. But going all the way to universal health care, that eliminates it. There's no longer any selection because you don't have to select into the plan. You're automatically in the plan. Okay, that was my economist pitch. Okay, guys, you have any other questions or comments? I think we can end here.